Welcome back. I'm Francie Stoner, President and founder of Laugh Foundation, and you're back with us for our docu-series. And today we have back with us Joseph Scaletta, who, if you remember, is a nurse consultant on infection prevention and control for the Department of Defense. Today, Joseph's going to be talking to us about this concept of herd immunity. And just what is that, Joseph? Thanks for being here.
Awesome. Thanks for having me again, Frank. Today we're going to be talking about herd immunity, which you may have heard of in the news. The whole purpose of this docu-series is to sort of break down some of the terms that you're hearing about COVID-19 and ensure that you fully understand what they mean and how they apply to your life. So what I'd like to do is share my screen here and talk about herd immunity. So the definition of herd immunity is really comes from our partners in agricultural and livestock raising. What they discovered over time was that some animals would get a disease and become sick, and others might not. As the number of animals that they have either had natural immunity from the disease, meaning that they've had the disease before, or through vaccination, that number that actually got the disease, even if a single case of disease in their herd was discovered, actually decreased with the greater number of people that we had vaccinated. So what does that mean for human populations and something contagious like COVID-19? So let's look at this slide here. The first, we'll break down each of the rows of boxes here. In the first top box, you'll see an outbreak in which a few people are infected. Those are the people in red, and the rest are healthy but not immunized or who have never had the disease. Very similar to what we see with COVID-19. Looking across that row, on the top row, you'll see that more and more people become infected. Those blue people are now turning to red, so they're not immunized, they're sick, and now they are contagious as well. So what happens if we have some of the population with either immunity from vaccination or through having the disease? That's our second case scenario here. And you see that those people with yellow, they either have had the disease or that they're immunized for the disease and healthy. When this happens, we have some people that are protected and others that are not. You're still seeing a lot of red on the right-hand side of the slide. It means that disease is going to spread through most of the population, but not all, because those people that have either had the disease or who have been vaccinated are protected. Now, really, the magic happens on the bottom row here. In this box, a large part of the population has either been immunized or has had the disease. And if you look, there's not that much spread, new red cases on the right-hand side. By having a good immunization coverage or a high percentage of the population that's already had the disease, you're actually going to prevent the illness from spreading significantly to those persons that are not immunized or who haven't had the disease. So the question of the hour is, how far are we away as a society from herd immunity? And I'll be the first to admit these data are complicated. It depends on how good we're actually doing serological testing to look for antibodies, and some places do it better than others. In New York City, the epicenter of the US outbreak, we are estimating that about 20% of the population in New York has antibodies to COVID-19. This gets even more confusing because just because people may have antibodies, that doesn't give absolute immunity. Something else that complicates this is that we don't know how long those antibodies will be protective, even if they are protective. In Wuhan, where the outbreak first started, we're seeing about a 10% antibody prevalence. And in Stockholm, 7.3. We're going to talk about Sweden in a little bit. Off to the right-hand side here of this chart, really what we're trying to get to, either through natural disease or through vaccination when it becomes available, is about 60% herd immunity will be protective for other parts of society. So some people may ask, well, why don't we just let the disease run through our society in the absence of a vaccine? If we can get that herd immunity up to 60%, that's going to be protective, right? That is right. However, along the way, what we're going to see is we're going to see increased number of deaths, increased number of sickness. And again, with COVID-19 disease, it could be mild to severe. And we also increase the chance of overwhelming our healthcare system. So just as a comparison, in Sweden did not take such strict measures to control movement or to restrict movement or close businesses or enforce really strict social distancing. These are the rates in the geographic area around Sweden with their deaths per 100,000 of the population. That's a statistic that Dr. Gann talked about in a previous episode. You see here that Sweden absolutely has the highest number at 43.24 deaths per 100,000% of the population. So herd immunity for COVID-19 may not be our best choice. The United States, you see there, is about 30. Countries such as Finland, Norway, and Denmark did a really aggressive social distancing, closing businesses, wearing cloth face coverings earlier rather than later, and you see their numbers are dramatically lower. So that is basically herd immunity 101. Hopefully that helps explain the phenomena that you're hearing about in the news, and I'm thrilled to be able to present this to you today. Francie, thank you for having me.
Joseph, it was great. It was great having you. And this is such an interesting topic, and you made it so understandable for all of us. So thank you for being here.
Thank you, ma'am.